In this module, we're going to discuss first aid. One question that one might ask is, why do I feel that I'm qualified to even talk about this? Well, I've actually in my life had 4 careers. The first one was as a United States naval officer. Most of that time I served with a Naval Mobile Construction Battalion, the Seabees. Then I obtained a Master's of Business Administration with a concentration in accounting, later became a certified public accountant, and was a business executive for over 20 years. And then at the age of 49, I decided I was going to do something different. So I taught at a major university for 7 years, and the subjects that I was an instructor for was accounting and business strategic planning and management. At the same time, I went to an accredited nursing college and passed the NCLEX and became a registered nurse. And I spent 6 long years in the hospitals, county hospitals, working in many facets of being a registered nurse. I was an intensive care unit nurse, a progressive care unit nurse, a medical unit nurse. I was on a unit that specialized in hemodialysis, and I also floated to the emergency room, our department on many occasions, and the mental health unit. So I feel I have a background to fairly present this information to you. I want to qualify. I am a retired registered nurse. This information is for general information purposes only. You should always seek out a licensed medical provider, a medical doctor, nurse practitioner, physician's assistant in your state for individual questions about yourself and others. Also, I'd like to tell you that one time I took some training from a medical doctor, and she said, look, there are always exceptions in medicine and in nursing. If I say to you there's absolutely positively no exceptions to this, that means there's a few exceptions. Also, the type of information in the healthcare field is constantly changing, and so you have to make a tremendous effort to maintain your current knowledge with the latest prescribed gold standards of treatment. One of the first items that I would share with you, though, is there's an old saying in the medical field and in nursing: you are only as good as your equipment. What should be in a family's first aid kit for disaster preparedness? Number 1 is a first aid kit from a big box store. So here's a simple example. These will usually sell for $10 to $25. And while I will call this a boo-boo kit for minor issues, it should be noted that although I call it a boo-boo kit, such supplies will cover the vast majority of your first aid request. And even a serious case. In the 12 essential modules of disaster preparedness, I share my father's story of where he used a kit with very similar supplies to this to help a young airman after he had traumatically amputated 2 fingers. And this type of kit should certainly not be underestimated. In 1914, President Calvin Coolidge's 16-year-old son had a blister on his right foot from playing tennis. A blood infection developed, and a week later he died. One wonders if a small antibiotic packet from a typical modern-day first aid kit could have prevented his untimely death. Now, what other equipment would we want besides just the first aid kit from a big box store? Well, one is you'll find that knowing somebody's temperature is very valuable. So I would recommend a temporal thermometer such as the Braun NTF 3000 US No Touch Plus, available at CVS Pharmacy or Amazon. And the way this works is you simply turn it on. There's a second button. You put it to someone's forehead and it gives you the temperature. Mine is currently 98.1, and they even have it color coded. So this is green, meaning it's normal. A second item I would suggest, a backup to that thermometer, is a non-battery thermometer such as the mercury-free glass oral thermometer C/F, available at Walmart or Amazon. This is a reliable backup to a battery temporal thermometer. Now, placed under the tongue and left there for several minutes, the normal temperature is 98.6. If you elect to take this and put it under someone's armpit, the normal range will be 1 degree less. You certainly should have medical gloves and masks and hand sanitizer for personal protection equipment. You should have scissors for cutting gauze and tape and clothing if necessary. And if the first aid kit does not have a good metal splinter tweezer, buy one and add it to the kit. For children, you should have a measuring spoon. This one is from Care One Med Spoon / dropper kit, and this is the spoon, and this is the dropper that you could insert into liquid medicine and aspirate out the amount you want, and then do the final measurement in the spoon. Also, you should have a bulb syringe for use as a nasal aspirator to suck mucus from a stuffy nose of a child who does not know how to blow their nose. There are some children's over-the-counter medicines that I would recommend. One is Pediacare, which is for very small children and is acetaminophen, or sometimes known as Tylenol. You should also have children's Tylenol liquid, children's Motrin oral suspension, children's Claritin liquid, and children's Mucinex. Pedialyte, which is a method to replace electrolytes in a child that has had extensive vomiting or diarrhea, and Decidin, which is for butt rashes. I would recommend that you have some additional supplies for major emergencies. One is gauze 4x4 inches. This will sell for a couple of dollars and will go a long way in an emergency. Also, rolled gauze 2-inch, once again, will go a long way in an emergency. Johnson & Johnson coach tape, adhesive tape. We've all seen this. This is the type of thing athletic trainers use and can be very helpful in all sorts of emergencies when you have to make up a bandage. Also, an item called Coach self-adhesing elastic tape bandage from Johnson & Johnson. This tape is all crumpled up and you can put it on, and one of the nice things about it, you can pull it off and have a second or third try at it. I would also recommend some major trauma supplies equipment. One is to have several Israeli battle dressings and or what's called a modular bandage from Tactical Medical Solutions. In many ways, in some situations, this would be the superior battle dressing. Have at least 2 CAT tourniquets, combat application tourniquet, or soft T tourniquet, and have 2 of those. Have 2 chest seals, either the brands Hyphen, Vent Chest Seal, or Halo Chest Seal. Have a SAM splint, and in some cases you may want to use a water gel burn dressing, but usually with burns, if you can get them to the doctor within 4 hours, don't put anything on them. Just get them to the emergency department, particularly if the burn is on the face, the hands, the genitals, the feet, the buttocks. And I would encourage you with burns to be very conservative. Take them to the emergency department. Having on hand over-the-counter OTC drugs at home for your first aid kit is also very important. A really wonderful article is the 10 Essential OTC Medications by Cynthia J. Coker, MD. Now, I was privileged to actually take 2 courses from Doc Cindy, and she is just a wonderful person, an excellent doctor, and an outstanding teacher. She recommends, though, 10 major drugs. 1, ibuprofen. The brand names are Motrin and Advil. Acetaminophen, brand name Tylenol. Diphenhydramine, brand name Benadryl. Loperamide, which brand name is Imodium. Pseudoepinephrine, brand name Sudafed. Meclizine, brand name Dramamine. Ranitidine, brand name Zantac. Hydrocortisone cream, bacitracin ointment, and clotrimazole, brand name Lotrin. I would in addition suggest to you to have on hand adult Mucinex, Claritin, Zanfil, which is for poison ivy and oak and sumac, saline eye drops, aspirin, and Gatorade. Gatorade is an excellent fluid replacement and electrolyte replacement for adults if they've had extensive vomiting or diarrhea. Some optional drugs would be Afrin, Monostat 1, and Silver Gel. By all means, with over-the-counter drugs, follow the manufacturer's instructions and precautions exactly. Let's review some suggestions for providing first aid. While complete instructions for applying first aid is beyond the scope of this video, here are some pearls of wisdom. Know the family member's medical history, each one of them. In particular, if they have a pacemaker, make sure you have a card that is the registration card for that particular pacemaker. Have it in a copy of it in every glove compartment of every vehicle and every wallet and purse in the family. That card can be extremely helpful in the case of heart problems when you go to the hospital. Know how to call for help, 911. Tell them what has happened and why you are calling. Tell them what you need is, in this day and age of cell phones, tell them your location and address as best you can. Know your way to the local hospital emergency department. Build a first aid kit and learn first aid skills. Take a hands-on first aid class from the Red Cross or other well-qualified first aid instruction company. Take a class in CPR and AED. Study first aid books. Now here's some basic rules of first aid. Don't panic. Size up the situation, particularly safety considerations. When you examine a person, use the mnemonic A, B, C, D, E. A stands for airway. Check and evaluate their airway, that it exists. Now, an easy way to do that is say, are you hurt? What happened? And if they respond to you without a stridor or stressed voice, they, in all likelihood, have an airway. The second part of that A is, are they alert? If they respond to you in an appropriate manner, they are usually alert to some degree. The B stands for breathing. Are they breathing? Is their chest moving up and down? The C is for circulation. Are they bleeding? Is their pulse rapid? Is it weak? The D stands for disability. Look for broken bones or loss of function. And the E stands for both exposure and environment. A complete examination of the individual requires providing for protection from cold or hot weather. Call for help as soon as you know you will need assistance. If someone else is present, most qualified should provide first aid and the other person should immediately call for help. Find out the method of injury, which tells a great deal about the possible injury. In penetrating trauma, such as knife and gunshot wounds and impalement from flying glass or objects, It may be necessary to treat massive bleeding prior to airway and breathing problems. Check for blunt force trauma, which includes automobile accidents, motorcycle accidents, falls from bicycle accidents, flying objects, such as being struck by a bat or steel bar or force of an explosion. All of these blunt force trauma will tell you how much injury conceivably could be happening to that person. Now, here's some caregiver tips. Provide sick persons, particularly those with vomiting and diarrhea, what's called a BRAT, B-R-A-T diet, which stands for banana, rice, apple, and toast. Now, a Gerber rice, banana, apple cereal can be very helpful in that regard. This is an example. It's good for children or for adults. And a matter of fact, it's excellent just as a breakfast cereal. So rice and banana, apple cereal by Gerber. I include this in my first aid kit. Inspect urine. A dark color shows dehydration and lighter color can show dilution. Look at the skin color. Pale white can be a sign of impending shock or the fact that they're in shock. If standing, get them down to a sitting position, or better yet, lie down so they don't pass out and fall, further injuring themselves from the original problems at hand. A blue color means they're not getting enough oxygen. Now, some precautions. Don't give aspirin to anyone 18 years or younger. Don't give ibuprofen to children under 6 months. Don't give Tylenol, acetaminophen to children under 6 months. Now, in all of those cases, there are some cases where a medical doctor would tell you differently. But I would follow those precautions unless a medical doctor gives you explicit instructions to do otherwise. Following are a number of books and DVDs that will be valuable to you to study first aid.